questions for the filler. So pretty much filler adds volume. So you could either add it to your cheeks, you could do the nose. So if you have kind of like a curved down nose or a dorsal hump, you could add it there. You could add it in the labor line. So say you're not frowning and you have that line coming down your face. You could add a little filler there to make that line go away, and then you add the Botox as well. You could do, obviously the most popular is the lips. You could do under eye filler. You could do jawline. So filler you could pretty much do in almost all places. A lot of questions I get asked is what's the difference with fillers, like brand names, because there's so many out there. So the ones we use here at Rev are all hyaluronic acid fillers. So they're easily, I like using those because there's different densities. So what I use for the lip, I won't usually use for the eye. It's just different name brands is how, depending where you want the filler. I only use hyaluronic acid only because it's easy to dissolve. So in case of an emergency, like an arterial occlusion or anything like that, I could dissolve it. Any other filler that's made of like calcium base, like a Radius or Bellafill, which is PMMA, that is really hard to dissolve. So you just run into more issues that way. So different brand names, obviously there's longevity. So anywhere between 9 months to a year. Some people get more out of it, some people get less out of it. Again, it's based on your own metabolism. You can't really know how long you're gonna get out of it based on your metabolism, you working out, if you're a smoker, runner, all that determines how long your filler will last, or if you're dieting as well, or actively losing weight. Downtime, usually it's 2 weeks. So lumps, bumps, bruises could last up to 2 weeks. If you feel like, oh, this side's bigger, this one feels hard, that's all normal for up to 2 weeks. So I always make you a 2-week follow-up appointment to make sure everything's okay. If you like what it is, you could always cancel your appointment, but your appointment will be made for 2 weeks if if you need to decide to add more or less or anything, any concerns that you may have. And like I said, if you completely hate your filler or something happens, we could dissolve it. It is very fixable. So don't hesitate in calling your original injector so we could fix any issues if there is any issues. It's a needle that's going into your face. It is a thicker needle than the Botox is. So it is, you have more chances of bruising and swelling. So icing is probably the best. Doing arnica, Tylenol, nothing that thins your blood. So no aspirins, no ibuprofen, nothing like that. Doing the arnica before, like 2 days before, will help as well. Another thing, if you get cold sores, especially with this weather now and the dry weather, cold sores, if you have a history of ever having a cold sore or a fever blister, you will most likely get one from after filler. So make sure you have your Abreva or have a prescription ready for you so you could start taking it prophylactically. Other than that, filler is pretty self-explanatory. You see your results right away. You might have a little more swelling. Most hyaluronic acid fillers absorb water, so in the mornings you'll feel more like they're bigger or anything like that. It's all normal. It starts to come down once your drainage happens. Other than that, that's pretty much it.